A goiter is a non-cancerous lump or swelling at the front of the neck and is caused by a swollen thyroid gland. The thyroid gland is a small gland in the front that makes hormones. It is often caused by iodine deficiency, one big disease called Hashimoto's disease or Graves' disease. It may or may not be associated with abnormal thyroid hormone levels. Symptoms range from a visible neck lump, which is usually painless, to breathing or swallowing difficulties, coughing, and hoarseness. Guess what? The good news is, it is treatable. Today on your regular health TV talk show, The Physicians, we'll be talking about goiter, what it causes, the symptoms, diagnosis, and management. Stay tuned. It's another day with The Physicians, where your health is our business and will always be our business. My name is Dr. Martina Agbere, a regular anchor on this program, and as usual with me is my very cerebral. Oh, remember we call her the celebrity shrink. She's no other person than Doctor.
I'm Dr. Memuna Yusuf Kadri. Welcome to your favorite health TV talk show, The Physicians, where your health is our business and will always remain our business.
Always our business. So we'll be talking about goiter today. That swelling, that thing that some, especially for females, sort of disfigures and.
I think I'm more particular about the cultural perspective of goiter. Remember, growing up, it's usually used to seem as if, when you have that, like, it makes you beautiful. Yeah. And we know it's a disease. Now, now being a doctor, like, how can they say somebody that is dying? Like, and the disease is treatable though, but like, oh, she's looking beautiful now. They will even dress her in a way that...
They think the person is more endowed. And when they put the beads on, it makes her really beautiful.
And it's a disease.
It's a disease. That is the truth. And now you see people that walk about with them. There was somebody I met in church some time ago, and it was really massive. And I asked her, "What are you doing?" And I said, "Well, she's not doing anything. She's just praying so that the devil will be saved.
She wants to pray.
She just wants to pray it away." Then for how long have you had it? And I said, "No, don't worry about that one. I know you want to tell me about surgery. Forget surgery, I'm not going to do surgery."
So that person is obviously in denial. But if it's showing, it's even better. What about those that doesn't show?
That is the most dangerous.
Yeah, well, we have an expert in the studio that I'm sure will come and give us more information, because people really need to know, especially for those that it's not showing, but you are experiencing that disease.
To make it even worse, somebody even said, "You know what, I understand that it's because of salt, lack of salt. So that she's increased her salt intake." I think well, we will talk about that. We'll be back after this short break. Ensure you are not going to watch this program alone. Just call your family, your friends, your colleagues, and the physicians that have started, because we're talking about goiter, what it causes, the symptoms, diagnosis, and management. We'll be back after the short break. Stay tuned.
Every day and in every way, enjoy that I find support. No matter the role you play, nutrient pack supplement for you and me. In your body, that I fight you.
Darvite nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Darvite from LB Pharma. Darvite, love yourself.
Welcome back. If you have just joined us, you're on to your regular health TV talk show, The Physicians, where your health is our business. And today we'll be discussing goiter, what it causes, the symptoms, the diagnosis, and of course the management. There's another person to do this. Really give us something that you need to know that is very important. You know what that person done? Our very intelligent, amiable Dr. Philip Ekhaiyeme. He is a consultant general surgeon with the Lagos State University Teaching Hospital. Doctor, you're welcome to our program.
Thank you very much.
You're welcome.
Thank you for having me on the show. Thank you.
Well, now we're talking about goiter. Maybe what is goiter? First of all, give us a general overview. What goiter is, its location, and everything before we dive into the main topic.
Alright, so goiter simply means swelling of the thyroid gland. Now the question is, what is the thyroid gland? The thyroid gland is the butterfly-shaped organ just on the neck. On the neck is a simple way to just describe it. But you know what a butterfly looks like? A butterfly-shaped organ. And it's actually responsible for the metabolism, meaning temperature regulation, food we eat, breakdown of the food we eat, heat itself, generating heat in the body, our mood and all that. So the thyroid hormone actually does quite a lot of things in our body. So the thyroid gland, which produces the hormone, is known as goiter whenever it is swollen from any cause. So when you say from any cause, it could be benign, meaning it is non-cancerous, or it could be malignant, meaning it is cancerous. So you say goiter is swelling of the thyroid gland. The thyroid gland is an extremely important organ for our day-to-day activities. Now, another way to look at it is this. The thyroid gland could be big.
Okay.
Yeah? And like I said, it's responsible for the regular day-to-day activities, right? How you are able to cope, how you're able to respond, how you're able to do different things. Now, it could be big and still be producing normal amounts of hormones.
Okay.
It could also be big and useless in the sense that it's not producing anything. So if it's not producing anything, what happens to the person? We say it helps with your daily activity. The person is dull. The person is weak, really can't celebrate at the level he should celebrate, does not eat well. Ladies especially would have issues with their menses and all that. Now, if it is big and it overproduces, becomes another problem too.
Okay.
Meaning everything is exaggerated. The person is always anxious. Some people you find out their eyes could bulge.
No, Doctor, I think before we even go into that, let's even, because we are already going to
The deep dive.
deep diving into. So, why is goiter more common in certain populations, especially in women? Because I'm picking from one of the statements you made now, the menstrual regulation. Yeah.
Yes.
So, why is it common in certain population, and then of course certain gender? Because now there's some
Yes.
gender preference when it comes to this goiter issue.
Yeah, thank you very much. So it's commoner in women.
Why?
As usual.
Why?
I wouldn't want to say why. One of the things you must recognize is
Because in
this.
this program, we've come to realize that most of the things that we talk about, they tell
In
you
health,
it's born
it's
in
women.
It's a lot that's
Well,
happening
there's
somehow.
quite a lot of
Yeah.
course men too, and some don't even differentiate between men
Yes,
and
you're
women.
right. Yeah.
But goiter is commoner in women. You say, why is it commoner in certain regions? There are
Yeah.
certain places that we call the thyroid belt.
Okay.
Now, the most common cause of goiter worldwide is usually iodine deficiency. Now, iodine deficiency used to be a problem. Ideally, the food we eat should provide the iodine that we require.
Yeah.
We just require very little. But again, industrialized, so many things have happened. Iodine usually should find it on the top shelf of the soil. Now, with so many things ongoing, you don't have it.
Yeah.
So people
Climate
become,
change issues.
people become deficient in iodine. And so because of that, you had goiter that became endemic in certain regions and in so many parts of the world. So it became a matter of public health concern. So it was at that point that they started saying, okay, we could put this iodine, least quantity in salt. And so you started having things like iodized salt and all that. So by the time you have it in salt, it gives you the quantity you require. And so it dropped the incidence significantly of goiter. Now, will I say this is the exact reason why women have it? It's more epidemiological data, meaning virtually everywhere you've checked, it's commoner in women. Again, women get pregnant, right? So the HCG, the human chorionic gonadotropin that helps in pregnancy, is similar to the thyroid stimulating hormone, which helps to regulate the thyroid gland. So maybe it could provide some answers as to why goiter is commoner in women, because most women generally would mature, get married, or get pregnant, and all that. So HCG rises, and it's similar in structure to what thyroid stimulating hormone is.
Okay. So in the course of our conversation,
Yes.
Dr. Memuna already talked about some being visible
Yes.
and some not visible.
Yes.
Let's talk about the types of goiter.
Alright, so the type, like I said earlier, it could be benign, it could be malignant.
What does that mean?
Benign means it's not cancer. Malignant means it is cancer. Now, there's another way to look at it. It could be toxic
Non-toxic.
or non-toxic, or you could say it could be hyperthyroid, euthyroid, or hypothyroid. So in some instances, the goiter is normal in size,
Okay.
but it's overworking. So you look at the person's neck and you really can't see anything. But the person is manifesting all the symptoms
symptoms.
of toxicity or hyperthyroidism. And what are these features? The person is anxious. The person is literally always jittery. Everywhere is cold or everywhere is chilled. The person feels hot and is sweaty. Why? Because of the metabolism that we talked about earlier. The person is sweaty, the person is anxious, feels the heart, the person has palpitations, the heart is beating, and the person is wondering. The person eats quite a lot of food.
But it's not showing.
It's not just that it's not showing, the person is losing weight.
Yes, so the person is losing
He's
drastic,
losing a lot of weight.
unexplained weight loss.
I've eaten 7 times today already. But because you eat so much, you also will poo a lot more than you usually should do. So the person is wondering, why am I losing weight? I'm eating quite a lot. And then in some people, the eyes could bulge out.
So it's like as if their eyeball is almost popping out.
Yes, it's popping
For
out.
those that their eyes bulges, are they the ones that are usually the cancerous types?
No.
Okay.
Again, usually it's associated with what is known as Graves' disease, which is an autoimmune disorder that occurs in certain thyroid conditions. So usually they're the ones who would have enlarged glands, the eyes will bulge out because the body is reacting to something that is to the thyroid gland itself, and then it attacks it because of something on the thyroid gland. So Graves' disease is a subtype of thyroid disorder. Yes. So it's one of those things that can cause the gland to overwork. And then when it overworks, the patient is just not well.
You talked about increase now, that's the
Yes.
hyperthyroidism.
Yes.
What about the
The hypothyroidism. Yeah. In some people, like I said, the gland could be big and it works just normally. It just works normally. In some other people, the gland is just not working at all. Or even if it's working, it's not producing enough to help the person cope with daily activities of life. So what happens in that instance? It's the reverse of whatever has happened. So you expect the person to be up and doing, right? The person is dull, it's listless, is just
easily tired,
easily fatigued, person barely eats well. Like I said, it drives the metabolism of the body.
slow.
Everything is slow about the person. And then the person meditates also slowly too. And then menses, like I said, in the hypothyroidism, there are both sides. You have menstrual irregularities for women in both sides too.
Now let's talk about, because people are listening. This thing, this massive thing on our, we often see. So I'm actually watching, I actually have it. They want to know the treatment modalities. How is it managed? How will they be able to cope with it? Especially for those people who are out there that have it and think it's a beauty thing. It's a thing to beautify them. So we need to actually speak to them at this moment. How do you manage it?
Alright, thank you very much. So, as with every disease, you first need to diagnose. Alright, the patient comes to the hospital, sees the doctor says, okay, the first thing you want to do is a thyroid function test. The thyroid function test tells you whether the patient is toxic, meaning the gland is overproducing, whether the patient is euthyroid, meaning the gland is big, but it's just producing normally, or whether the patient is hypothyroid. So, without thyroid function test, you know what to do. If the patient is hypothyroid, you need to give replacement thyroxine so that the patient at least comes to what normalcy looks like before you even think of operating the patient to remove the goiter. For the hyperthyroid one, the patient has to be euthyroid, meaning the patient's thyroid hormone levels has to be normal. So there are certain drugs that are used, anti-thyroid drugs that are used for that. You have to take care of both the effect of the thyroid gland and also some of the autonomic effects too. And so by the time you do that, the patient becomes euthyroid. Now, the modalities for treatment will now depend on what the diagnosis is. So how do you get the diagnosis? You found out whether the patient is now euthyroid. You want to also find out, could it be benign?
Okay.
Could it be malignant?
Okay.
So there are different modalities. You do imaging, ultrasound, CT scan. Ultrasound, usually you could just with that do a fine needle aspiration cytology or a biopsy, and it tells you whether it's benign or whether it's malignant. In some instances, it might not be able to differentiate between whether it's benign or whether it is malignant. Now, so the question now is, what are the options of treatment? Now, like we said, the patient has to be euthyroid. If it's a benign disorder and it's not disfiguring the face, some patients could decide that they don't want to do anything about it, which is fine and valid. You just have to monitor them. Now, for patients, one of the most common cause of surgery is cosmesis. Many people don't like what it looks like on their face, on their neck rather, and so they want to get off. They want to take off the thyroid gland. Now, some people are also there that are scared of surgery. So the question is, apart from surgery, which other options are available?
Exactly.
There's what is known as radioiodine therapy. Radioiodine therapy is usually for small glands and for those that have diseases like Graves' disease and the other hyperfunctioning glands. Now, if the gland is so big, the amount of radioactive iodine you will have to give the patient will be toxic to treat the disease, so you don't want to do that. So usually you prefer surgery. Now the question is, what are the types of surgery? Surgery could be partial, it could be total.
Okay. So partial meaning taking part of the thyroid.
You are not removing everything. Let's put it that way. Let's not say.
Yeah, exactly.
Any reason why you want to do partial?
Usually I don't do partial. I prefer taking out the entire gland, and I will get to it. It's now that we now have other treatment modalities like radioactive iodine, even if it's cancer, whatever is left can be sorted out with radioactive iodine. And so I think I personally would go for total thyroid. Some of my colleagues still do a partial.
Partial. I want to go back.
And well, it does work for some people. It does work for some people. But again, the reason why some people that do partial, like they say, is because of the complications. Again, we now know that the complications are limited in very skilled hands. In people who have large volumes, they don't have such problems.
Yeah. So I'm happy we are breaking it down with regards to how, the different treatment modalities, and how you don't want to go back there. And it makes a lot of sense, because for our viewers, some listening now will be like, but if it doesn't involve the right and it's only the left, why would you want to? These are the doctors they will just want to do everything, those kind of discussion. But you gave a very valid reason. What if the test comes out and it's malignant? That means you are going back, and the more you go back, the more you are putting the patient at risk. But now let's go back to something that we should even do before we make a diagnosis, do investigation and all that. Can goiter be prevented? That is one part of the question. Yes, especially through diet or lifestyle choices, because we want to use low-hanging fruits. Because if we talk about prevention, we don't want to talk about big terminologies or person say, these are the things we need. No. Let's narrow it down to lifestyle, the basic diet, our lifestyle choices. Can prevention come from that?
Okay, so in terms of prevention, there's some things that we need to talk about. I talked about the fact that iodine deficiency used to be notorious.
Very endemic here.
Endemic areas where you have goiter. So, taking iodized salt.
Okay.
Making sure that when you go to the market to buy salt, you have to see
educated iodized, yes.
The thing was made compulsory now.
Yes.
It was compulsory. So, you have to be certain that it's iodized salt you're taking. You want to avoid certain goitrogens.
Okay, such as?
Now, there are certain vegetables.
Okay.
Wow. Yeah, certain vegetables. But not so many of them are. A good number of them are not so common around here.
Okay.
Cabbage is also notorious for.
Cabbage?
Yes, it's been mentioned. But
Wow.
the question is, how much cabbage are we consuming that would cause
Oh, it's true.
So those are the things. So
Yeah.
the balance has to be there.
So it's quantity.
It's the quantity. The quantity actually matters also. So in terms of lifestyle choices,
But not that people are using for weight loss.
Yeah, because people use it
Yeah,
instead of swallow,
they do
instead of the yam and all that, they use the cabbage, they blend it and turn it and use it for swallow.
Yes,
So
I
the quantity is
understand
now increased.
but they also use salt. They take iodized salt.
Okay, so it cancels out.
It does help.
Okay,
So
okay,
it
let's
does take care
look
of that
at it
too.
that way.
So unprocessed cassava products. We see a
unprocessed.
lot of cassava products in our country.
Yeah.
Gari and all those
Gari,
things.
yeah, fufu and all that.
Or let me say improperly processed.
Okay.
When it's not properly processed, cassava products have been shown to contain to be goitrogens. And again, people who have had neck irradiation, that's not so common. Maybe those have had childhood cancers that have required radiotherapy, but that's not so common. Again, in terms of lifestyle choices, you want to make sure that they're taking cassava products, they are properly processed. You want to make sure that you're taking iodized salt. Then, essentially that. But there's something that I think I should draw our attention to. Goitre is something that affects women a lot. For women of childbearing age who have had total thyroidectomy, meaning all the goitres have been, for any patient that has had total thyroidectomy, like we said, the hormone it produces is what helps to drive the body's good. So it has to be replaced.
Yes.
So you don't just do the surgery and then
not
you leave the
do
patient.
that.
So the patient is taken every day.
Okay.
Especially if you're in childbearing age.
Yeah.
If you are not
Whether you're childbearing or not,
for life.
Okay, for
you're
life.
going to take the drug for life. And the drugs, they are readily available.
Is it affordable?
Very affordable. Very affordable. It's accessible. It's available. Now, for women of childbearing age, because a lot of women come down with goitre, it's important that if they get pregnant, they are not the type that will come and dilly-dally. They shouldn't dilly-dally. They should go for ANC immediately and then see an endocrinologist or the surgeon who operated so that the doses of the L-thyroxine that they are receiving can be titrated appropriately to meet the growing baby's needs.
Otherwise,
Yeah.
Otherwise, the woman will give birth to what is known as a cretin.
Yeah.
So you don't want that. And you know, we talked about the fact that the thyroid gland does quite
A lot of functions, yeah.
So you have a child that is slowly mutating and a lot of problems. You don't want to go into that. You want to prevent it. You don't want that to happen. So if a woman has had total thyroidectomy, she's of childbearing age, she must be told that if you have surgery, please. You have to be close to your surgeon or your endocrinologist, and you have got to register for antenatal immediately.
Yeah.
So these are very, very important things that we need to put out there to the public.
Yeah. So as we round up,
Yes.
Dr. Phillips, I want to speak to our viewers now.
Yes.
Specific, just to that camera.
Okay.
What is the biggest myth about goitre that people need to stop believing?
Yes, so there are a good number of them. I will say, for now, it's been demystified. Demystified in the sense that most people now realize that it's something that can be treated.
Okay.
It is something that with surgery can be cured.
Okay.
So people now know that, and they now, and in fact, most people, it's a disease that can be seen by anybody. For most patients that will come around will tell you that they didn't know anything was wrong until a relative or a friend or a church member or a mosque member pointed, there's something going in your neck, and they go get evaluated and it's sorted out.
So thank you very much, Dr. Philip, for coming on our program. I'm particularly excited having you here and appreciate you
Thank you.
for at least agreeing to come on the program. It's been a while. We've been looking for a doctor to handle this particular goitre. And I'm sure our viewers are very excited because so many messages have been coming. When will you get us an endocrinologist? When will you get us somebody to come and discuss goitre? And I'm happy you have done justice to this particular program. Rest assured that we are going to come back again so that we will talk more about some very, very important topics that are still pending, like rectal bleeding. So on that note, I want to just say thank you to all our viewers out there for being part of our program today. We discussed goitre, we talked about its causes, the symptoms, the diagnosis, and of course, management. And from what Dr. Phillips said, it is treatable. The main reasons why people go is mainly just because of cosmetic reasons. But then, you need to know the reason why it is there. Is it a benign tumor or a malignant one? Benign being mean that it just stressless, there is no, it's not cancerous, it's not the malignant one. But then it is better to always take it out. He's a surgeon, so it's always better for him to take it out and see what is in there. So I just want to say thank you again for being part of our program. My name is Dr. Martina Agmerie. Till next time, stay blessed.
Thank you so much, Dr.
Thank you
Phillips,
very much for having me.
And we are happy you came in, and we are hoping that next time we call you, you'll be right there. To our viewers out there, you've all heard about, this, in quotes, goiter. It's a treatable disease, and if you have a friend, a relative, or you are having it right now, please go see your doctor and get it out there. You can live a normal and healthy life after you've done the treatment. Be kind to follow us on all our various social media platforms: Xspace, Facebook, LinkedIn, Instagram, and we have over 300 videos on our YouTube page. If you need a place where you'll get the right information, where you don't be biased when it comes to health, go to our YouTube page, The Physicians, and you'll be glad you did that. And like I said, be kind to follow us and share with every other person. Until next time, my name is Dr. Memuna Kadri. Remain blessed.
Every day and in every way, enjoy that I find support. No matter the role you play, nutrient pack supplement for you and me. In your body, that I fight you.
Darvite nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Darvite from LB Pharma. Darvite, love yourself.